Hi, I'm Dr. Sabrina Solt. Thank you so much for joining me. I want to take a few minutes to just share with you how I've been helping arachnoiditis patients over the past few years. So arachnoiditis, as I'm sure you know if you're watching this, is a very severely degenerative disorder that's usually a result of some sort of traumatic injury that has happened to the back. And this results in a very painful disease process where there is clumping of nerves and basically damage to nerve tissue that can affect the lower body and even parts of the upper body in various ways. People can end up in wheelchairs, people can lose function of their urine, function of their bowel, and of course end up in very severe pain with a lot of neuropathy, burning, tingling. And it has been an honor to serve these patients over the past few years with various regenerative medicine approaches. So normally in these situations, there's kind of a twofold or almost threefold approach that we have to look at. One of them being that we have to be able to get the body into a state that's conducive to healing. And I've been in touch with another gentleman, Dr. Forrest Tennant, who is actually a leader in this field, and his approaches have been shown to really help that a lot. And I'm very much a proponent of a lot of the nutrients that he recommends for patients to use to kind of get their body into that healing state and to encourage that nerve regeneration and of course prevent further degeneration. Secondarily, we are going to approach this using targeted regenerative medicine injections to the regions that have been affected. Now, this doesn't necessarily mean injecting into the spinal canal itself, because of course we want to make sure that we are not causing any further damage whatsoever, but that we're actually being able to place the products that we're using where those nerves are kind of exiting the spine in what's called a perifacet region. And it's going to allow the nerves to actually start to heal and repair. We also do other systemic therapies as well too, to allow basically any other parts of the body that have been affected the opportunity to heal. Now, during these procedures, patients usually report that it is one of the easier things that they've had done in their lives. It really is not a tough time for most people to handle. And as far as results go, many of my patients usually start seeing results within the first 6 weeks. Namely a reduction in pain, reduction in flares. I've had some patients who've been able to start to walk stairs again, who have been able to leave their wheelchair behind, who have been able to stop taking pain medications. All of these things are possible for you if this is something that you're dealing with. Obviously, we would need to discuss your case in detail because everybody's different. Everybody comes to me at varying degrees of severity, and based on that, I can usually give you an idea of what to expect when we work together. So we do have complimentary consultations available, plenty of information on the website as well. So feel free to check that out and reach out whenever you'd like to have a discussion, and I look forward to working with you.